Well, what made me decide to become a nurse was that my grandmother was a nurse. And I really wanted to be a teacher. And she told me, she said, girl, you're going to starve to death. And so I'm so glad she suggested it and I followed suit because nursing is awesome. Anything that you want to do, you can do it in nursing. If you want to teach, and I taught nursing for a while, research, you can do research, you can do informatics, you can do clinical, you can be in nursing administration. It's awesome.
Well, I wanted to be a journalist, as it were. And then my mom told me I needed to go into something where I was going to earn a living right out of college. So that would be nursing. My mom's a nurse. My grandmother, my great-grandmother was a nurse. So I fell into it, I guess you might say, in that way. And I applied to Hampton, and they had a great nursing program, and I went into the nursing field. So some of the progressive things that I've noticed over the years is the African-American community. We have stepped up in our efforts with being more in tune to our healthcare. I have noticed that. I have noticed we work out more than we ever have, especially in New Orleans. An increase in just staying on top of our annual things. So if you're over 45, having your colonoscopies done, having your regular diabetic checkups if you are, say, pre-diabetic or predisposed to that kind of thing. Just all sorts of health hallmarks that have been made as it relates to advances in the African American community. Absolutely. Hospitals are, and I don't know, it doesn't feel like it's always been this bad, but it has definitely been a challenge to keep staff because they have so many options now, and they travel, and people want to travel, and I get that when you're young and you're single and you're a new nurse, you do want to travel, you want to see the world. I did it, so I understand the need to want to go out, but it definitely hurts the local hospital's situation. So, you know, and it's the ratios are not optimal.
In fact, I was in the heart of the pandemic until I got COVID in July of 2020. And so what we saw was that the teams really came together. And we had a COVID unit. One of the units they designated for a COVID unit. And so there were staffing issues because a lot of people did not want to work with COVID patients because, of course, it was a new virus, coronavirus, and it was a lot of uncertainty. But they know they had to isolate, and they would really wear gear like almost like the Ebola, if you ever saw that Ebola movie. They had masks, they had shields, they had full PPE garments, gloves up to here, you know, but the team seemingly, from what I was an administrator, but my staff of registered nurses and and social workers worked with, you know, the patients. A lot of things they had to do by phone because of COVID. And so they would even teach by phone, discharge planning and that kind of thing. And they would talk to the families even by phone because at that time, you know, they stopped any visitors. There was no visitors coming into the hospital at COVID, and everything basically, you know, it's shut down.
Mm-hmm. For one, we don't take care of ourselves. Being in the South, it is very difficult to maintain a healthy lifestyle in a lot of ways because poorly. And I don't know if I should say that. African Americans, we eat poorly. We like everything fried, and I think it's a Southern thing too. Everything's fried. So my friends came in from Hampton this week. She had a speech pathology convention. It was a couple of them from Hampton, and so we always get together whenever one of us is in the next person's town. So she's like, after the first meal, she was like, oh my God, Nicole, is there anywhere we can go and get something that's not fried? And she's like, in Virginia, you have to really go out of your way to find fried food. But here, you have to go out of your way to find grilled, baked, steamed, smoked, you know what I mean? Everything but fried. So with that comes health problems, as we know. And African Americans, we're more predisposed to diabetes, high blood pressure, all of the other 99 cardiovascular diseases there are out there. So it is a constant, that's the word I'm looking for. There's constant education and re-education and pushing a healthy lifestyle in the African American community.
Of course, because of it being predominantly Black, there is some disparity. There's healthcare disparity in the treatment methodologies for Black patients as it is opposed to white patients. And of course, in some instances it's blatant, and other instances they try to camouflage it. But there is a overt disparity in healthcare in the New Orleans area. And I worked at Charity Hospital, and Charity is like our university. It's an academic facility. I worked there for years, and even in that environment where it's a state-owned, it was a state-owned hospital until Katrina. And being a state-owned facility, you would think that they know they're going to get patients that are underinsured and uninsured, as well as by being a level 4 trauma center. If people have an accident, they would come there. But there were some overt disparities. When a patient came into the emergency room and coded, and the doctor actually opened the chest in the emergency room to do manual compressions. It was a gunshot wound. And so it was unlike Charity. It wasn't at Charity, it was at St. Claude General. And because at Charity you have something called room 4, and it actually can turn into an operating room, because you have the huge lights and all the sterile equipment, and you have that flow of air that prevents contaminated air from coming in the backflow. But it was very interesting to see the surgeon, Dr. Gibson, I will never forget his name, actually, we call it crack the charts, but he did a surgical incision and did manual CPR. The patient came out of a bad rhythm, and for a short period of time had a good heartbeat, but eventually that patient did expire.
So my most memorable experience in nursing was here at University Hospital, and a guy comes in and he's like, we need a wheelchair, she's having a baby. So we all run out there to the car. The seat is leaned all the way back. She's laying there, legs open, but still has a pair of like terry cloth shorts on. The baby's face is in the shorts. The head is out, the neck is there, and you can literally see the imprints of the baby's face, the nose, everything right there. And all we could do was cut her shorts off right there at the driveway of the emergency room and deliver the baby in the car. That is my most memorable experience, and that had to be 1998, 99.
It's wonderful. It is. Nursing is a wonderful field. I used to tell my students, the wonderful thing about nursing is you can be basically whatever you want it to do because of the diversity. And that if you're good to nursing, it'll be very good to you.